Let's learn about ARDS. What is ARDS? Acute respiratory distress syndrome. Okay, so here, which part of the lung is affected? Trachea, alveoli, bronchus, bronchioles, alveoli, diaphragm. What do you think? Which one is
Alveolar.
it? Alveoli is
Alveolar.
affected. Okay, very good. So alveoli loses its ability, loses its compliance. Okay, so here we'll do a question here. Fancy. Yes, fancy. Good.
Yes, Father.
Yeah, go ahead. Fancy.
A patient SpO2 is dropping down, which are the first sign indicating hypoxia. So, what are the signs and symptoms of hypoxia? That select that all apply. One is agitation. Um, Agitation is true. Then
Yeah, you go ahead. After you finish, I'll correct it.
then refractory hypoxemia. Uh, I think that is true. Restlessness is true. Respiratory acidosis is true. Confusion. Um, confusion. Uh, Confusion. I'm not sure, but yeah, false. Cyanosis. Yes, true. Diminished lung sound. True.
Okay, so what happened, Fancy, is you just focused on the signs and symptoms of hypoxia. The question is not about the signs and symptoms of hypoxia. The question is about the first signs indicating hypoxia. Okay, look at here. The first sign indicating hypoxia is a question. Okay, so remember when the first organ, I have already many times I have said like the first organ to affect is your brain. Okay, so the first sign should be related to the brain. Agitation is related to brain. Refractory hypoxia means um, we are not able, like even if we give oxygen, we are not able to revert or we are not able to bring up these SpO2 of the patient. Okay, so we are not able to treat the patient even after giving a lot of oxygen. Okay, so nothing is happening. So it's not responding. Patient is not responding to oxygen therapy. So all those things are very later stage, right? So this is no. Restlessness, again, brain. The first sign is affecting brain. Respiratory acidosis and all is a later stage. So
Last.
no.
Yeah.
Confusion affecting brain.
First.
Cyanosis and all later. Diminished lung sound, patient is dead. Okay, so your answer is agitation, restlessness, and
Confusion.
confusion. Okay, all those things happens later on uh, in the stages of hypoxia. Okay, so here one important thing we already learned about brain problems, especially in conditions like hypertension. Okay, hypertension, patient will have same thing, agitation, restlessness, confusion, and also headache will be there. Okay, and also what else we learned about in UTI for elderly people, they will become confused and disoriented in elderly people. Then we learned about renal failure, uremic disorder. So the urea can go into the brain and cause confusion, and also it will lead to encephalopathy, uremic encephalopathy. Then we have urea, then ammonia in liver failure. It can affect the brain and cause these things. So please remember those important things. One is oxygen. When there is lack of oxygen in the brain, the first sign is our brain signs like agitation, restlessness, confusion, disorientation, and things like that. You got it? Fancy clear?
Yes, Satya. Yes.
Okay.
Thank you.
Now we haven't learned about ABG. I'll teach you about ABG probably tomorrow. Okay, so very easy, not a big deal. But here this is not an ABG question, but just try this question. So here, sorry, I have put the normal ranges here already. pH is 7.35 to 7.45. PCO2 is 35 to 45. HCO3 is 22 to 26, PO2 is more than 80. For our concern here is only PO2 and PCO2. So we are just focusing on PO2 and PCO2. Right now, I'm not going to talk about pH and bicarb and all. In the next class, in tomorrow's class, we'll learn about pH and bicarb. Okay. For now, let's focus on PCO2 and PO2. That is what given here. The normal PCO2 is 35 to 45. If it is more than 45, which means that the patient is not breathing properly, so a lot of carbon dioxide is accumulating in the lung. Less PCO2 means less than 35 means all the carbon dioxide is washed away because of too much of breathing. Okay, hyperventilation, things like that. A lot of carbon dioxide is washed away from the blood. PO2 more than 80 is a normal. Okay, please don't confuse with SPO2 and PO2. They are totally different. SPO2, what is a normal?
80 to
SPO2?
100.
No.
95 to
90,
95,
saturation above 90.
above 90. Okay, actually, if it is less than 87, you have to start oxygen therapy. Till 87, it is acceptable. Acceptable in the sense it's not good. Okay, so actually 100% saturation is good. Okay, but as it drops down, you can accept, like you can go till 87. If it is less than 87, there is nothing, you have to immediately start oxygen therapy. Like for nurses, we can start oxygen therapy 2 liter on nasal prongs and then inform the doctor. Okay, so please remember that. Okay, so here don't confuse with PCO2 and PO2 and SPO2. So they are different. So SPO2 is more than 80 is normal. Okay, so now let's do this question. Nisha.
Yes, Father.
Yes, Nisha, go ahead. Just give me a second. I don't know why this is. When I try to look into your names, for some reason. Yeah, go ahead, Nisha.
Yes, which arterial blood gas values support suspected acute respiratory failure? So the question is asking about from the range which will which is a suspected respiratory failure. So number one, PCO2 55 mm and PaCO2 47 mm. So PCO2 55 and respiratory failure. I think the first option I will keep that. The second option 62 and PaCO2 32. That is also looks like high. And the third option 47 and PSO2 63. That is not very low. And the fourth option, 82 and PSO2 22. So the suspected acute respiratory failure is fourth one.
Why? It was a very easy question. What happened, Nisha? See, look at here. We are looking only into PCO2
Yeah.
and PO2. Okay. So PO2 55 means uh, more than 45. It's more than
Yes.
45. So it is high, not good.
High.
PCO2 is 47. Sorry, I mean PO2 is 55, which is very low. I mean, I'm sorry.
Low. Mm.
Uh, PO2 is 55, which is very low. Sorry. Okay, so it's very low, so it's not good. PCO2 is 47. 47 means a little bit high. Okay, so
High.
I'll just write not a big deal. Okay, not a big problem. Okay, not a big deal. Now coming to the next one, PO2 62. 62
Is
PO2
high.
62 is also bad. It's low, so it's not good. PCO2 is 32, a little bit low. Again, it's not a big deal, right? It's little bit low, not that bad. PO2 is 47, very bad. Okay, it's very low. PCO2 63 or 45, it's too high, right?
Yeah.
It's too high and too low, which is very bad. PO2 82, PO2 more than 80 is normal, right?
Oh yeah.
So this is normal, and PCO2 22 is very bad. Okay, now among this, which one is the more worst? Which one is the worst?
Number
Nish-
3.
Number three. Three is the worst. So that is your answer. Okay, we have learned about this strategy in the beginning. Do you remember in a tie question, like a comma question,
Mm.
count the number of problems? Okay, so the problem which wins, the option which wins with the number of problems, that is the answer. Okay, so clear, Nisha? Okay,
Yes,
so
Father.
be mindful, relax. I know that we all have a lot of issues going on in our life, but take this as a priority and learn. You will get it. Okay. Satya, Satya, you there? Okay. Sabia, Anthony, Sabia,
Ajay, I attended the morning class.
Srijana. Okay, Sabia, no problem. Srijana,
Yes, Father.
and Srijana, go ahead.
Mm, which which among the following patients are at high risk of getting acute respiratory distress syndrome? So the question is asking which of the following are high risk for acute respiratory distress syndrome? Uh, Select all that apply. Number one, it is sepsis. Yeah, I will give this option because it can cause ARDS. Number two, pulmonary edema. Um, I will keep this option. And number three, pulmonary embolism. I will keep this option. Number four, pneumonia. I will eliminate this option. And number five, congestive heart failure. Um, acute respiratory distress syndrome. Six, acute pancreatitis. Um, I will keep this option. So, uh, one, two, three, and six.
Okay, so I don't know what happened, Srijana. I think you didn't think properly while answering this question. Is there any reason you choose one? Can you explain? Is there any reason you choose one? Because I want you to think properly to answer the questions. Any reason? Sepsis? Srijana, hello.
Yes, Father.
Yes. Is there any reason you answered sepsis? Do you have a rationale for that? And do you remember I told you you keep it, you eliminate it? No. For select all that apply question, yes or no, true or false. Okay. So please don't get away from that. Okay. So sepsis, um, because there is an infection in the blood. Okay. So this infection can go into the because the blood is supplied to the lungs, right? So it can get the lungs can get infected and can cause ARDS. Yes. Pulmonary edema goes into the alveoli. Okay, the fluid goes into the alveoli. It affects the alveoli, so it can cause ARDS. Pulmonary embolism, same thing, it caused damage to the alveoli. Okay, because there is no carbon dioxide oxygen exchange, ARDS. Pneumonia, you said no. Why? I was just very worried about that. I mean, just now we were talking about pneumonia. I said that pneumonia is an infection in the base of the lungs and the inflammatory exudates collects in the alveoli. And I was very upset, Srijana, when you said pneumonia is not a high risk for, I mean, it's not a risk for ARDS. It's not a cause for ARDS, right? So think properly when answering this. Don't answer just for the sake of answering. Just attending my class, listening to my class won't help you for pass the exam. For sure. Even somebody, I got an inquiry today. She asked me like how many people will pass in your class and all. I said I cannot say that. Okay, I don't even say boast about my classes. Oh, you come and attend my class, you pass. No, if you learn, you pass. Okay, so I don't want to say give false information to people saying that oh, come and attend my class, you pass. You study, you pass. Okay, I'll show you the pathway. This is how prepare for the NCLEX, and you prepare, you pass. Okay, so it's not just simply attending the classes. Okay, so pneumonia. Just now I mentioned pneumonia is the base of the lung and it affects congestive heart failure. We know that again, pulmonary edema, congestive heart failure are connected together, right? So in congestive heart failure is also will also the fluid get into the alveoli and it affects the alveoli. If you would have made a mistake about pancreatitis, then I would have accepted. But again, I have several times mentioned about pancreatitis, right? Pancreatitis, the inflammatory fluid can leak and it can affect the alveoli, right? Because the lungs and pancreas are closer. So in pancreatitis, the rupture of the pancreas, the leaking of the pancreatic enzymes can cause damage to the lungs, lung tissues, and lead to. So basically, all the six options are high risk for ARDS. Got it, Srijana? Clear? Okay, so keep on doing, practicing. I'll say at least listen to all the classes 3 times. Okay, so that everything you will become that person which I want you to become. Okay, so maybe one listening to one class won't help sometimes. Repeatedly listen to the classes. Okay, and as I always say, I'm not teaching you. I'm just changing your behavior. Okay, so I'm changing your attitude towards NCLEX. Okay, so PEEP. What is the full form of PEEP? Positive end expiratory pressure. I'll talk about this in the last class of respiratory system. PEEP is about, you know, it is a setting in the ventilator or in the BiPAP machine where we can set the PEEP, which means that positive end expiratory pressure. For example, positive end expiration. Let's talk about end expiration. End expiration means at the end of expiration. Okay, at the end of expiration, the BiPAP or the ventilator will push a pressure. You finish expiration. At the end of expiration, a pressure goes into the lung. And what happens? This pressure will keep the alveoli open so that now during inspiration, the alveoli can catch enough oxygen and help with oxygen carbon dioxide exchange. So that is known as P, positive end expiratory pressure, which is an important setting in the ventilator or in the BiPAP machine. I'll talk about all those things in the next classes. Okay, so PEEP is a very important setting for ARDS patient because it keeps the alveoli open so that it can receive enough oxygen and then help with the oxygen carbon dioxide exchange. Okay, we'll talk about that later. ARDS intervention, put it in sequential order. What do you guys think? Which one goes first? A patient is having ARDS. Okay, acute respiratory distress syndrome. What will you do first?
Position.
Position is first. Then what will you do next?
Listen.
Listen to the lung sound. Then
Yeah.
Oral suction and oxygen.
oral suction. Notify the
Notify.
healthcare
Notify.
provider. Okay. Next, we are going to talk about asthma. Okay. So that's all about ARDS. Few important information what I want you guys to know for your exam, but they are not just about ARDS. They all are generally about respiratory compliance, respiratory problems. Okay. So now we are going to learn about asthma. First, let's start with this word paradoxical breathing. Paradoxical breathing is not just a sign of asthma, it is a sign of any kind of respiratory problems. Okay. Paradoxical breathing means normally when you inhale, the chest expands. Okay. When you exhale, the chest goes inside. But in paradoxical breathing, the opposite thing happen. When you breathe in, the chest goes inside, and when you breathe out, the chest comes outside. So something opposite, which means that the patient has a very compromised lung. The lungs are not working properly, which is an emergency condition, which is very bad. It's also, it indicates that asthma is getting worse or COPD is getting worse or whatever condition, respiratory condition is getting worse. Okay, let's do this question here. Archana? Archana?
Yes, Father.
Yes, Archana.
I don't see the question, Father.
Yeah, just give me a second.
Which
What about
among
now?
the yeah,
You're
it's
good.
visible. Which among the following is a priority sign for an asthma patient? This, option one, dyspnea. Second, tachypnea, and third, wheezing. Fourth, the absent breath sound. I can eliminate option one, dyspnea, and option two, I can eliminate tachypnea, and option three, I can keep And option for absent breath sound, I can eliminate. I can go with the option three, wheezing further.
No, Archana. The answer is option four. That's what I say. We need to read word by word. Which among the following is a priority sign? Okay, priority means I have always said which one kills your patient, right?
Okay.
Dyspnea, will dyspnea kill your patient? Maybe, but not immediately. Tachypnea, maybe, but not immediately. Wheezing, yes, for sure, but not immediately. Absent breath sound, right now. Patient is
Yes.
almost dead, right? So this
Yes.
is your priority, or just simply think like this.
Okay.
That is what I said. We need to change our attitude towards looking at a question. I look at the question totally differently than how you guys look at the question. Okay, what I did is, I took these four people. When I learned about priority, I just imagine a patient with dyspnea, a patient with tachypnea, a patient with wheezing, a patient with absent breath sound. Whom will I take care of first? I'll go to the patient with absent breath sound. What you did is you were thinking concretely, thinking about asthma, hallmark sign of asthma, and trying to answer. So see, the different way of thinking makes all these problem. Got it? So what I
Yes,
want you
sir.
guys to do is, you have to change the way you look at a question, and it can happen only by practice. Even I was like same thing. But when I kept on doing, when I started doing a lot of questions, then I understood, okay, so I should change my way approaching question differently. Then I felt like, okay, when I think like this, okay, my answers are getting right. So then, I changed my thought completely. I changed my attitude towards answering question, and that is when it clicked for me. Okay, so yeah, got it clear?
Yes,
Ashna?
Father. Thank you. Yes, Father. Thank you.
What is status asthmaticus? Have you ever heard about status asthmaticus?
Worsening of the condition. Exacerbation.
Okay, yeah, worsening of the asthma status asthmaticus. Actually, it's not just worsening, it's irreversible. Okay, so you are trying to give rescue medications for asthma, but it's not working out. Okay, so only management is there is no management. Whatever the medicine you give, it is not working well for the patient. Okay, so do you know what are the medicines for asthma? I mean, what is the emergency management for asthma? It's very easy to remember.
Albuterol,
AIM, albuterol, ipratropium, and methylxanthine.
methylphenidate.
Okay. Uh, Albuterol is the priority. I mean, the first choice of drug in case of asthma attack. Okay. So, which means that these these emergency medication are not working on this patient. Okay, so it is not you're not able to reverse the patient's condition, and that is known as status asthmaticus. It's not just worsening. Okay, let's do a question here. What is the treatment for status asthmaticus? Indomethacin? What do you guys think?
Yes. Medication.
Okay, it is a medication, but it cannot treat status asthmaticus, right? Just now I
Okay.
said status asthmaticus cannot be treated with any medications because the meaning of status asthmaticus itself is it is irreversible. Okay, it's not actually it's not irreversible. It's not responding to medication. Okay, the meaning of status asthmaticus is not responding to rescue medication. Okay, beta blockers,
No.
no.
BP.
No.
It's
No.
a blood pressure medication, no. Intubation,
Yes.
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 Peak flow meter is a diagnostic thing, so no. Okay, so intubation is the answer. The only management for status asthmaticus is to intubate the patient. Okay, now coming to peak flow meter. So to learn about peak flow meter, um, so this is peak flow meter. But first, let's read about peak flow meter, and then we'll come to asthma action plan. Okay. So peak flow meter, most important thing, it is a diagnostic measurement to see how the patient is doing. Okay, so you will ask the patient to sit in an upright position. and put the scale in 0, lowest value, and ask the patient to inhale deeply and then put the mouthpiece in the mouth and create a proper seal with the lips and exhale quickly as possibly. This is very important thing. Okay, so quickly and forcibly as possible. That is where it is recorded. So the ability of a patient to exhale quickly and forcibly is what recorded in this peak flow meter. Okay, got it. So this is where many people make mistakes because yeah, NCLEX will give you options like inhale slowly and inhale slowly, okay, or exhale slowly. Okay, they give you different options and they confuse you. So it's remember, okay, exhale quickly as possible, forcibly. There was a question for another student they asked, and she also didn't answer it properly. This was about spirometer. Okay, spirometer, a diagnostic test. So patient is going to spirometer diagnostic test, not about exercise, spirometer diagnostic test. So actually for spirometer, it measures the vital capacity of the lungs. Okay, how much air the lungs can hold. That is what we do in a spirometer. Okay, so in spirometer, we'll ask the patient to, okay, inhale slowly. Okay, inhale slowly as much as possible. Okay, so because it will record how much amount of air the patient is able to take inside. Okay, but she just made a mistake there. She wrote exhale quickly and forcibly, thinking about peak flow meter. She just got mixed up with peak flow meter and this thing, spirometer. Okay, so peak flow meter is ability of you to exhale quickly and possible. Spirometer is to measure how much air you can take in, the vital capacity of the lung. Okay, so please be mindful of those two things when you're reading. So remember once again, peak flow meter, spirometer. Uh, okay, so slowly inside. Okay, so please remember that. Okay, now coming to repeat two more times with a break of 5 to 10 seconds and record one score the highest of the attempt. And that is your score. And we use this peak flow meter and also with the sign and symptoms to categorize the patient into three categories: green, yellow, and red categories. Actually, there is a asthma action plan scale. We use that scale and you will tick and you will answer those scale to see what are the signs and symptoms, what is the peak flow meter reading, and things like that. Okay, so somebody asked me what is the peak flow meter reading for yellow and red. It's not based on that. It's based on peak flow meter reading plus the signs and symptoms. So it is not a question. They won't ask you for yellow what is a peak flow meter reading, for red what is a peak flow meter reading. They won't ask you that. Okay, so because it depends on the scale. Okay, not just on the peak flow meter reading, but the normal peak flow meter reading should be 80 to 100 percentage, and without signs and symptoms, the patient will be in green zone. Okay, so reduced peak flow meter reading along with some signs and symptoms could indicate there is a problem with the treatment. We need to change or update the treatment. The red zone indicates that patient need an emergency management, a rescue medication or rescue treatment is needed in this case. Okay, so that is how the asthma action plan is categorized based on the peak flow meter reading and the signs and symptoms of the patient. Okay, so this is one important question for your exam to know about peak flow meter and asthma action plan. Got it, everyone? Clear? Good.
Good.
Okay. So these are the medications. Sorry, before that, let's do this question. Which statement by the patient indicates correct understanding of asthma triggers? Select all that apply. I should stop smoking. True or false?
True.
True, because smoking
True.
is a trigger. True. I should avoid strenuous exercise. True or false?
No.
False.
False.
False,
False.
because they don't have to avoid strenuous
False.
exercise. They can limit strenuous exercise. Okay, so strenuous activity they don't have to avoid. So that's false. If any signs of upper respiratory infection or any infection, I should inform the doctor. True or false?
True.
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 Yeah. True.
I should take medication before exercise. True or false? I mean, not a typical NCLEX option, but I just added it for you to learn something. As there is a particular medication you can give before exercise, and that is known as cromolyn. I'll talk about that later. Okay, so this is true. You can give not a typical NCLEX option. Okay, I just added it just for knowledge. Okay, I should avoid cold weather. True or false?
True.
True.
True. Stress does not cause an asthma attack. True or false?
False.
False. Okay,
False.
so basically, smoking, infection, cold weather, and stress are the triggers of asthma attack. Got it? Now, coming to the medication, easy to remember, not a big deal. Okay, so remember sorry, remember AIM, AIM acronym. Again, I'm not a person who is in favor of acronym, but many NCLEX learners have used AIM. Even in hospitals and many places they use this acronym AIM for asthma. So that's why I just added it. It's not just it's a very commonly used acronym, so that's why like the what is it, like many common acronyms, like what to say. Do you guys remember any common acronym? FACE for CVA, FACE acronym. Okay, I hope
Yeah.
probably you would have learned about all those things last week. I sent you the video. Okay, so FACE is an acronym. Sorry, is it phase or fast? Okay, sorry, fast.
Fast.
Fast is an
Fast.
acronym. Yeah, very good. Fast. Fast is an acronym for that. So same like that, AIM is an acronym for asthma, where it means that albuterol, ipratropium, and methylxanthine. Albuterol is beta 2 agonist, which is the first choice of rescue medication. First choice. Okay, so second choice is ipratropium. One important thing about ipratropium is patient with vision problem, patient with bowel problems, patient with urinary problems, patient with a dry mouth should be concerned, because people who are taking ipratropium are at high risk of getting vision problem. They cannot pee, they cannot poo. Constipation will be the dry body. Okay, dry mouth. Okay, all those things are the symptoms. So you should educate the patient about the signs and symptoms, and let the patient know that if you have any of these symptoms, please report to the doctor. And methylxanthine are not commonly used because of its toxicity. It can cause seizure. So because of its toxicity, we are not using methyl. I mean, there are people using, but again, not commonly used medication. Okay, because of its toxicity. So we usually go with albuterol and ipratropium. Okay, so that is about AIM. Okay, so please remember this: albuterol is beta 2 agonist, ipratropium is anticholinergics, theophylline is methylxanthine. Okay. Uh, Now coming to anti-inflammatory medication, steroids. Okay, steroids, beclomethasone, the what is that? The puffer, the orange color puffer we use. So basically, it should be used only with a spacer, because this is a steroid which can cause inflammation in the mouth. And also, after using, make sure that the patient wash the mouth properly. It's a very important question for your exam. People using steroids, inhaler, beclomethasone, they should use it with a spacer. And also, after using, you should provide mouthwash. Why? Because it could cause oral thrush. Okay, so Montelukast is a angel. Okay, because Montelukast is very commonly used medication, very commonly used anti-inflammatory, which do not cause much problem to the patient. Okay, which is a long-term medication. Okay, mast cell stabilizer, cromolyn. This is what I told you, which is given before exercise, which can help with before exercise. Okay. So these are few important information about bronchodilators, and anti-inflammatory medication, which they will ask you in your exam. Any questions you have? Okay, one last question. Saxon. Saxon. Okay, Ruby.
Yes, Father. Father, screen.
1 minute, Ruby. Okay. Yeah. Here, go ahead.
Uh, which medication should asthma patient avoid? This is a starter question. Albuterol, this medication for asthma. No. False. Um, acetaminophen. False. Ibuprofen. This is a NSAID, I think. This is a true. Beclomethasone also avoid. False. Cromolyn also avoid.
Why beclomethasone? Why avoid? It's a steroid, right?
Sorry, yes. Sorry.
It's not an NSAID. It's a steroid.
Okay, steroids. Cromolyn also. Atenolol, that is beta blockers. We can avoid that one also.
Very good. Don't forget about beta blockers. We already learned about beta blockers. Beta blockers, even without a respiratory problem, causes breathing difficulty. So, with a respiratory problem, beta blockers are not good. And ibuprofen and NSAIDs are bad, always bad. Okay. So, let's stop for today. See you guys tomorrow. Thank you, everyone.